So I am very pleased to introduce Professor Rebecca Wolfe. She is a leading expert on political violence, using behavioral science to design and research programs to reduce violence. She is a senior lecturer here at the University of Chicago Harris School of Public Policy, and she's also the executive director of the International Policy and Development Program. Professor Wolfe draws on her policy and academic backgrounds to research important development issues, design interventions that are theoretically grounded and evidence-based, and communicate both to diverse audiences. Prior to joining the faculty at Chicago, she led research and program development related to conflict and fragility at Mercy Corps, an international development and humanitarian agency, and she is also able to draw on her extensive practitioner and academic backgrounds to effectively research important development issues, design interventions there. Oh, I just said that, sorry. To multiple audiences. Over the course of her career, she's developed conflict prevention and violence reduction programs globally, including Kenya's largest youth development program, gang violence prevention in Guatemala City, countering violent extremism programs in Nigeria and Yemen, and community-based conflict management interventions in Iraq, Syria, Sri Lanka, Indonesia, and Tajikistan. I now am really pleased to introduce Swani Ramchandani, the Harris student who participated in Professor Wolfe's recent Careers in International Development Policy course to share a student perspective on learning with Professor Wolfe. Swani, to you.
Thanks, Blake. Hi, everyone. I'm Swani, and I'm a first-year Master's in Public Policy student at Harris. I'm passionate about leveraging policy for climate action and international development. It's been a true privilege to share my experience as a student of Professor Wolfe. Having taken a Careers in International Development class last quarter, I can confidently say it has been one of the most transformative experiences in my academic journey here at Harris. I admire Professor Wolfe's teaching style the most. She has an incredible ability to take complex problems and solve them into engaging, thought provoking discussions. Her classes were always structured in a way that encouraged us to think critically and look at world problems through a lens of practical solutions and not just theoretical solutions. In her classes, she often incorporated case studies, real world applications, and her own experiences on the field, which made them a lot more richer and easy to relate, and which also added layers of depth and richness to the course and made the sessions more engaging. The most fun part about her classes were speakers that she invited so that we could get a more real world experience and get to hear more stories about people out there. For me, what stood out the most was how approachable and supportive Professor Wolfe has been over my journey here at Harris. Despite her extensive experience and accomplishments, she is extremely humble and has always been available to help me understand uh, issues that I have of the course or helping me carve out my next steps in my career, international development. She's helped me navigate the nuances of the field, help me understand what kind of careers exist in international development, and directing me to the right people that have also helped me understand a bit more about the kind of jobs that exist out there. Those introductions, paired with the insights I have had from the class, have in international development space. I'm extremely grateful for that mentorship and guidance I have received from Professor Wolfe. And I'm sure I'm not alone in saying that she's left an indelible mark on me as a student and of all the students that she's interacted with in the past. So thank you so much for your guidance.
Thank
Uh,
you, Swani.
yes, thank you. I'm feeling quite embarrassed already. That was a very generous introduction, so I very much appreciate it. And Blake, thank you for inviting me to do this tonight. I'm sorry, did I cut you off or should I? Okay.
Nope, I was just gonna let you roll.
And thank you everyone for coming tonight or today or whenever it is in your various time zones. So today I'm going to talk about the title of the talk, as you can see here, is how policymakers can best use behavioral theories in program design. I'm going to base that on some of the work that I've done both in practice as a practitioner of someone designing programs, but then also someone who has then, of course, coming from a research background, wanted to know if the programs she designed actually work. Uh, let's see. So how did I get here? And I will say um, I'm a social psychologist by training. So definitely a bit of a black sheep at the Harris School, though work with many economists and political scientists as collaborators. Um, but I was always interested in bringing psychology to studying world problems. And so, particularly the issue of conflict. The first course I took my freshman year of college was a course on the psychology of peace. And there I was exposed to the fact that, yes, there are economic incentives for why people and why countries fight. There are political ideology differences, but also there are people behind these decisions. And so why do groups fight? And what are the psychological biases that make it hard for people to come to resolution? Um, why is this doing this? Okay. And so from early on in my academic career, I was started to think about the behavioral theories about why do we get stuck in conflicts. And so a couple underlying tenets of the work throughout my career and what is underpinning many of the courses that I teach at Harris is a couple of things here that I want to highlight before I go into the meat of the talk. So a basic theory of social psychology and really behavioral science is behavior is a combination of the person and the situation. And as policymakers, what we have influence on is the situation people are in, the type of stresses they're in. Is it easy to apply for a program? Is it hard to apply for a program? Is the way a building is constructed a way that fosters interaction or keep people isolated? Where we don't have at least direct influence is on the person. They're going to come with their own personality traits, they're going to come with their own experiences. And while a given situation is never always, it won't influence everyone the same way, um, we are able to know through research the way, if we construct a situation in a certain way, how much of that population will be influenced to make better decisions. And so as policymakers, we want to see, can we create situations that influence people to make decisions that are better for them and often for the collective good? So help people say, make healthier decisions, help people make better financial decisions. And so that's kind of one of the basic tenets of my work and behavioral science in general. Where much of this thinking also came from. So I did a postdoc at Princeton Policy many years ago now. And at the Princeton Policy, actually all students are required to take a semester of psychology. And Danny Kahneman, who wrote Thinking Fast and Slow, when he came to Princeton, that was one of his um, requirements, is that as part of that, all the students would get policy. All the students would get psychology. And the thinking there is that if we are, as policymakers, if we're designing policies that are influencing people, we actually have to understand people. And so that, again, is a kind of a tenet underneath my work, is that for the most effective policies, we have to understand the people we're trying to influence. The third and fourth tenet is based on actually not my background in psychology, but during grad school, I worked at an organization called Partners in Health. Uh, it's Paul Farmer, who unfortunately passed away a couple of years ago, was one of the founders. Jim Kim, who used to be president of the World Bank. The funny story there is I was hired to help him write a book criticizing the World Bank. And so you never know where your career is going to go. So I was working with the two of them. And one of the things that happened while I was there, we were working in Peru in a shanty town outside of Lima, and we had uncovered a strain of multi-drug resistant tuberculosis. And WHO policy in those days said you couldn't treat the poor with this form of tuberculosis because they wouldn't be compliant with the treatment. And so we would have more resistant strains of the disease. We were able to, we literally smuggled the drugs into the country to be able to treat these patients with MDR-TB and show that you could actually treat the poor with MDR-TB. And through collecting of data and being able to eventually get to decision makers at WHO, we were able to change global policy on how to treat the poor with MDR-TB. While, I will say this experience was was very early in my career. It was in the mid-90s. This has stuck with me so much about how the importance of evidence in informing policy. And the question is, we often don't know if our policies and programs are successful. They're all in some ways an educated guess of will it work? The question is, do we set it up for able to learn to see, can we actually inform bigger policies? And so that in many ways, particularly programs are an amazing opportunity to pilot potential policies in the future. So, as I said, I did my postdoc at Princeton, and I will say I got somewhat disenchanted with academia during my time there. Because psychology in those days was largely very, and admittedly somewhat still, it was very lab based. And while I believe in the value of lab studies where you bring people in and manipulate a situation to see how it affects them, that wasn't for me because it was too removed from the real world situations that I cared about. Um, and so through various connections, was able to get a job at Mercy Corps designing conflict programs. And the first program I designed was in Sri Lanka. And so Sri Lanka I designed this, I was there starting in 2007. It was post tsunami, and which had happened in 2004, at the very end of 2004. Uh, and but Sri Lanka was still going through a very long civil war. This was towards the very end of that civil war. And the US government, to this day, still has a fund to promote reconciliation between conflicting groups. And so I was asked to design a program. And so it was in Eastern Sri Lanka. Um, and so largely where Ampara is, which is further south, and then Batikola in the north, further north. And but I remember being there and talking to various people and driving around and thinking, oh my, how cool it was that I was starting to bring theory to practice. So I had spent at that point, the last 10 years of my life or so studying theories, thinking about how they applied in the real world. And here I was getting a chance to actually design a program that would be implemented in reality. And one of the reasons this was an interesting area to do it is because this area of Sri Lanka was one of the few areas of Sri Lanka where all three groups that are are the main groups in Sri Lanka and were fighting actually resided. And so, and because of that, actually, the Buddhists built this peace pagoda there. There's not many, there's about 16 in the world. And I actually asked one of the priests, why did you build this pagoda here? It's in a pretty random place. Not many people will ever go there. And what he explained to me, it was because both in Sri Lanka, the divides were largely between the majority, the Sinhalese, who are mostly Buddhist, the Tamils, who were the second biggest group, who were largely Hindu. And then there was a portion of Tamils that are Muslim in Sri Lanka. During most of the Civil War, they did side with the Sinhalese. But it was a complicated place. Also, you had people speaking different language, really hard to bring them together. And so the idea, but what we did was to think through how could religious leaders, in the sense, enhance contact between the groups. And often what was happening in these days at this point is that like there would be some misunderstanding or some like even just a traffic accident that ended up being between the two groups, and often would then through rumors and whatnot and misinformation would escalate very rapidly and turn into violence. And so the idea was, could we have religious leaders try to build connections between groups so these incidents wouldn't escalate into violence? And so the underpinning of actually both this program and actually this whole US government program, called, it's referred to either as the Reconciliation Fund or the People to People Fund. And the basis of it is a social psychological theory, a behavioral science theory that has started in the 50s by Gordon Allport. I will say that is his chair. I used to sit in it during grad school. It was in my office. That's where I would study. Um, he- uh, and I did not know I would do contact studies later on in my life. But the idea is if you bring people in contact, you'll reduce prejudice. And largely the thinking is the mechanism there is, if I get to start to know you, I will change my opinions both of you and your wider group. And so I will be less likely to act discriminatory towards you. I will and have not have these prejudiced ideas. And it's been applied to social divisions around the world. But the challenge of contact theory empirically and the evidence up for it has been questioned, partially because a lot of it, as I said, why I got disenchanted with academia and left to do field work, was that most of the studies were either in the lab, where you would bring groups together who in a sense, you would create groups. So I would randomly tell you, you're on the blue team or you're on the red team, and then I would have you interact in the lab. Or it would be, so there wasn't a lot of external validity to those studies. The There are also quite a few studies that are observational in nature. And so, for example, you look at kids who go to a summer camp. So Seeds for Peace is a well-known summer camp in the US that brings both Israeli and Palestinian children or Arab children together. They've worked with pre-Cold War US and Russia. And so, or USSR, I should say. But the problem with generalizing from those studies is we don't know from, are people self-selecting who are open to prejudice reduction anyway. And so we don't know, is it the contact per se, or is that these are open people who would have changed their minds anyway? So recently, there's been an upshot of what we would call field experiments on contact theory, where you randomize who is in contact with the other group across some type of social division, and who is not, and see, do attitudes and behaviors change. And so what this is a meta-analysis done by colleagues, and what they find in this, and there's a lot of information here that might be hard to see. The y-axis is the effect size, the x-axis is the standard errors, but largely what this is showing, like the gold is disability, and what we're seeing is like divides like disability that aren't don't have are related to long histories and animosities, their contacts seem to be more effective than so you see the bright pink boxes, those are more about religious conflict where there we could be a quite historical animosities. There, the type of program hasn't been as successful. It's been a positive, but the effect size is smaller. And so, kind of in summary, what like their work has shown, this kind of summary of the contact studies has generally been is that while there's been this growing literature of contact theory, particularly in conflict related or post conflict areas like Israel, Palestine, Iraq, and Lebanon, um, uh, the effects tend to be weaker. What we're also seeing from this work, and I'll come back to this later, is that behaviors appear easier to shift than attitudes, which was surprising to many people. And then a paper by a colleague, Salma Musa in Iraq. It was one of the few papers that wanted to see does what happens through contact in her study was with Muslim and Christian young men in Iraq. Um, does that, in a sense, move off the soccer pitch? So when kids go to, say, the market, are they interacting with each other? And then does it spill over to other people? And she didn't find any evidence of that. And so one of the big questions then, like the applicability of contact theory in conflict situations is like, if it's only going to be in the circumscribed space, like how effective is it really? And so can we start what would be needed for contact to lead to behaviors outside the situation, in essence, that the policymaker, or in this case, the researcher is creating? Do we need attitude change for that to happen? And then there's this idea of peace writ large. So when the U.S. government is spending, and I'll say they spent up to $30 million a year on these programs, at least as of 4 days ago. Do we need the hope is that this leads to societal change. And so how does this actually spill over? How does contact between, say, 100 individuals lead to community change? And so these were some of the questions that, as someone who was designing a lot of programs, and I will say when I designed that first program in Sri Lanka, I got so excited to be doing it. And then very quickly I was like, but does it work? Unfortunately, it took me so that was in 2008 that program was funded. It took me to 2015 to find a program I could finally really be able to study well. We had done some pre-post evaluations, but nothing some quasi-experimental studies, but nothing randomized. And but in 2015, we were successful in designing a program in Nigeria's Middle Belt. So this is an area of Nigeria that is one of the few areas of Nigeria that's pretty evenly split between farmers and herders. It also has an overlay of religious conflict between the farmers, while not all, are largely Christian, and the herders or pastoralists are largely Muslim. And so, this is not the conflict most people hear about in terms of Nigeria. I've also done work in the Northeast related to Boko Haram. But this conflict actually has a high cost in Nigeria between these farmers and pastoralists. When we did this work, it had caused 7,000 deaths in the prior 5 years. Now it's about 16,000 deaths. The cost to the GDP back then was $13 billion. It's like if it would save the economy 13 billion if we had gotten the violence down to zero. And so while this is low level conflict, it has it really affects people's lives. And the reason for the conflict is quite complex. And I am realizing how long I've been talking already, so I'm going to move on. But if people have more questions about the conflict, I'm happy to talk about it. And this is just to give you an idea of the area where this is taking place. And so we designed an 18-month program. It had 3 components. I'm just going to talk about the first 2. One was training leaders to resolve conflicts peacefully. I will come back to that in a couple of minutes. The main part of this study we were trying to look at were these joint committees, where we were trying to facilitate a trust between farmers and herders. And so we had leaders on both sides, about 8 people on both sides, be on these joint committees to try to work on projects that would help their both communities. And so we had 3 basic hypotheses that this would improve. By being in this program, people would have better attitudes about the other group. We would see changes in security and increased peaceful behaviors, particularly behaviors towards the other group. So we did a 2-level design. One is we did a randomized controlled trial where we had we had budget for 10 communities, and I'll say so it's not so that's all we had, but we actually, in our assessment, we identified 15 communities that actually needed the program. And since we couldn't reach them all, we randomized which ones got it. And so 10 got the intervention, 5 did not. I will say, because the program was successful, the US government did extend the program, and those 5 control sites did eventually get the program, but we did not know that when we started. And so we surveyed about 100 people per community. And each site had 1 farmer community and 1 herder community. But as I said, one of the things we really were curious about was, does this program spill over to other people? And so we also wanted to look at those who were directly involved in the program. So those on the committees who were having the contact with one another, those that were in the communities that may be exposed to contact but weren't the direct participants, and then those in the control community. And so we also looked at that as a panel over time. We have 3 sets of measures. We did surveys, public goods game, which it failed miserably, so I'll leave it at there. And again, in the Q&A, I'm happy to answer questions about it. And then I think one of the coolest things we did on this was we did behavioral observations. So I've worked now with this group for many years. It's a local organization in the Middle Belt called PARE. And they sent some of their staff to the markets and social events and counted how many farmers and herders were there. And so we got to see, like, again, some of this spillover behavior that I was talking about. Did the behavior go to things beyond those committee events? We do have a couple limitations in the study. Every study has limitations. This is a low sample. I will say I was surprised that wasn't a bigger deal in our review process to get it published. But that is a limitation of the study. The other thing I realized, so we had hoped to randomize people onto the committees. I talked about that self-selection bias. It was naive of me and insensitive of me that I didn't realize that people would not want to be randomized into volunteer work, that is something people needed a choice about. And so we could not randomize. So people self-selected onto the committees. They were not randomized on the committees. The biggest limitation of the study, though, probably is about 2 months before the end line was conducted, one of the states we were working in, Benue State, passed a no grazing law, which hurt the pastoralists much more than the farmers. And it caused a lot of violence in Benue State. To this day, many of the pastoralists have not gone back. And one, I thought it would wipe out anything in the study. But I'll show you what we think happened in a moment. But it also meant that as I said, many of the pastoralists still haven't gone back to Benue. We surveyed them in other locations. And so who we were able to find was more of a convenience sample than the whole sample. And so we don't know if they are somehow different than the original sample.
Professor Wolfe?
Yes.
Have a question from Anur. I hope I'm pronouncing your name correctly. Anur asked, curious about the role local researchers or actors played in the research design and evaluation, especially given the culturally sensitive nature of any conflict and how you went about establishing partnerships.
Okay. So this was done so I would say in terms of the research, probably in the overall research design, less so. One of the program manager for the program, Danjuma Dawab, he is a co-author on the study and was very involved on like the survey measures, making sure what we did was acceptable to the communities. The local partner, led all the enumeration and again was very involved in developing and piloting the survey. One of the things that has helped me do research is because did the study when I was still at Mercy Corps. And so I helped design the program, which was again input from local communities and the local staff, as well as having those partnerships and long relationships with the team on the ground. So that is a rare advantage that I have in doing that. We had been in Nigeria for about 3 or 4 years and had run similar programs. And so that was part of the reason the initial program manager felt comfortable doing a more prescribed, like an RCT, which is less, there's more divides, I will say, like of that type of research approach. It's a very seen as Western research approach. And so we were sensitive about that. And we wanted to do something where we felt it was a program that had a lot of local input before we put that kind of constrained model on it. Blake, any other questions, or to the person who asked the question, did I answer your question?
We got a
Okay.
thank you, so I think we got that taken care of. Thank you.
Okay. And so here are the main results of the study. And so what I'll say is we didn't see much change. We saw a little bit of change in social events. We didn't see any change in farmers going to the market. The reason we don't see any change there is that the markets were in the farming communities. But we do see a huge shift in the fact that in communities where the program existed, pastoralists were still going to the market, versus we see fewer pastoralists in markets where the program wasn't. Again, we don't see much change in reported contact willingness, but willing to engage with the other side, but they say they are engaging with the other side. It's a little hard to make sense of that, but The fact that they're doing it makes us, and the fact that we have that market data made us pretty confident in those results. We see a big shift in security or perceptions of insecurity. People in the communities where the program was felt much more secure. And then in attitudes, we see a positive shift. Largely, what we were looking at was comfort with the other side and attitude and trust in the other side. And as I said, we didn't see any change in the public goods. I think it was because in a low literate population, the exercise was too complicated. And so I think it was just noise. I wanted to show the trust, which is one of the attitudinal measures, because this is, as I mentioned, what happened was towards the end of the program, there was all this outbreak in violence. And so what seemed to have happened is in places where the program was, things improved, but not a ton. But what happened is places where the program wasn't, things got worse. And so, one, if we had only looked at where the program was, if we didn't have any comparison, we might not have thought the program was successful. And so, one, that's like a teaching point I will often use both in classes, but also working with teams, thinking if how they want to design an evaluation is if you don't have that comparison, you might lose some important learning. So if we hadn't had that comparison, we might have thought the program was a failure and the government wouldn't have expanded it to those control communities. And then I'm actually gonna, I'm trying to think for time. I'll just say very quickly with this slide, what we're largely showing here is that, of course, not surprisingly, participants move the most, but we do see that those in the communities where the program was did change, just not as much as participants, but more than control. Okay. So kind of the main points of this study is that the importance of one, like bottom up approaches. This was a community led peace building program. And despite what was happening around them, it helped them, in a sense, maintain their relationships despite the political environment they were in. But the study left us with a couple of questions. So, as I said, seems attitude spread, perceptions of security, people change that, but the contact between the non-participants didn't change, at least not reportedly, although because of the market, there clearly was some contact between them. And so what my colleagues, my co-authors on the paper, we're wondering, is it because, so as I said, there were committees, they actually created projects, they had grants to have these projects. Was the fact that the contact was public and the fact that there was a physical demonstration of that contact, did that change, in a sense, create the spillover? And then this idea that's pretty powerful in behavioral science is that norms are more likely to change behavior than change. Like if we try to change norms versus changing attitudes, we're more successful in changing behavior. And in a sense, because there was this like physical, like people had this, saw their leaders interacting, did that change their perceptions of norms? And that's why we saw this spillover. The other thing we found that a lot of studies have not found is we saw both attitude and behavior change. That's pretty rare. And so we wondered if it was potentially because of the length of the intervention. And so there was one confusing finding here as well, is that while we weren't really looking at the dispute resolution, and we were able to isolate that the results we found were due to the committees, we did see that while people didn't think dispute resolution improved, they did have these perceptions of better security. And so that seemed odd to us. I was fortunate that Mercy Corps had a follow-on program, And I was able to convince both Mercy Corps and the US government, USAID, to say, can we isolate just the mediation component of this program for 1 year to see if that's effective? And so I am very quickly, because I do want to leave some time for questions. Sorry, I really didn't think this would go so long. So we did another RCT. I will say the USAID mission in Nigeria thinks if I'm involved in a program, it must have an RCT in it now. And we had 88 communities, so a much bigger study. And we had 44 communities get the mediation training, or leaders in that community got the mediation training, and 44 were control. And we did, the first baseline was about 2,000 participants, but then we did the midline, or like basically a post-intervention at 3 or 4 months, had about 4,000 respondents. And then we did an end line 3 years later. And I will say this research is done with Caitlin Reardon, who's a postdoc at the Development Innovations Lab. And I'll say we did this over COVID, which I still can't believe we were able to pull this off. Um, and the team pulled it off on the ground in particular. And so what we see here is, so the green kind of circle is the midline, the orange is the end line. And with violence outcomes, we see, so a lower number means lower violence. And so what we see here is that in general, things improved in both midline and endline, and some things get slightly better with more time, but not a ton.
Quick
However, when we
question.
look,
Oh,
yes,
I had a question that was relevant when you were speaking on the
yes.
previous slide. Manor asked, are these programs continue to be monitored over the years? And if yes, until when do we need in order to establish if the program was a success or a failure? And hoping you'd reference the Nigerian project as an example.
So I think it's very rare that we get an opportunity like I had in this program. So it was a 5-year program. And as I said, I was able to work, I think because I had such a close relationship with the teams on the ground, I was able to persuade them to kind of carve off 3 of the states that the program was in, and try to to let us randomize something with just those 3 states and just do it for a year. Um, and what's really been really cool about that is the fact that that learning could then be incorporated into future years of the program. Um, Initially, I had only asked them for 1 year. We actually, in the end, were able to get them to pause for 3 years. There was a different intervention we overlaid. I'm not going to get into that. But that is a very rare opportunity. I mentioned this meta-analysis early from Levy-Palak and Don Green and others on the contact theory. They have another review paper, and one of the things they have said is maybe why we don't see so much attitude change from these, whether it's contact theory or other prejudice reduction programs, is the fact that they aren't long-term, and we don't have that long-term follow-up. So it is pretty rare. I will say, Professor Kremer here at Chicago, he's done some really interesting long-term work on his deworming study, and Professor Blattman has done a couple of follow-up studies, um, both of his Uganda work and his Liberia work. But again, they're rare. I will say part of the challenge has been the academic incentives aren't strong for that follow-on work. The first paper gets published, and it's much harder to get the subsequent paper because it just says, okay, you either kept the result or it went away. And then the other challenge, but actually we're looking to do some more follow-on work on this study I'm talking about now, based on some of the methodology that Professor Kremer did on the deworming, is while we know now all the communities are getting mediation. Some will have more of a dose than others. And so the fact that getting it earlier, did that help people? And so we're going to look at some other outcomes. And then I think we like to know how long is just, it's really hard. I'm not sure I have a straight answer on that.
Actually, then to follow up that would dovetail. I have two other
Yes.
questions that came in. One that dovetailed from Sam Strauss was, is there a way to assess how these communities have changed following the conclusion of the studies? Have the trends identified held?
So, yeah, so one of the things we're hoping to do on the study I'm talking about now is um, actually, um, let me go to this slide because this will help talk about it. So I'll get to my slides while I answer the question. And so you see here how economic interaction increases by midline, but then really increases by endline. There's a huge difference. We also see trust moves, but not significantly slow at midline, but it is significant at endline. So what I think is happening is the fact that we see this reduction in violence that allows people to have these economic interactions. They go they go well, and then there's increased trust, and then there's this positive feedback loop. We don't have economic data yet, or the economic data wasn't long enough to show economic effects. So we're planning to go back, or hoping to go back. We're trying to figure out how to do that now, into the communities to see, does over time having a more secure place, and if we see these more economic interactions, does that actually lead to economic differences between these communities? And so that's our long-term hope right now, which I would be very excited to be able to do. But that one of the reasons, again, I think as mercy courts, slightly easier to do that, although I use the word slight, is that I'm working with an organization and a local organization, PARE, that has long ties to these communities, so it makes it easier for them to go back. It's much harder if you don't have those relationships. And so, like you said, there was another question?
Yes, thank you. This is from Nike. Apologies if I'm mispronouncing your name. The first question was, has gender been considered with contact theory? Particularly considered, we hear a lot from the women, peace, and security agenda about women's roles in peace building and mediation, but we don't really talk about it at the behavioral level. That's the first one.
So I will say we looked to see if there were gender effects in the two studies I presented here. We didn't have any. I'm not saying so, and there were in both studies. So there were women on the committees in the first study, and there were women trained as mediators in the second study, even though those weren't the only people polled. But they were part of those programs, and it didn't seem to affect the larger community in either way. And so there, I will say, so I've been talking, yesterday, this was, the first study was part of my lecture in my translating evidence class, and then students interviewed me for a podcast about about behavioral science and program design. And so I've talked quite a bit about these over the last 2 days. And so one of the things that came up in, 3 of the studies that we looked at, were the contact studies were with just young men. And so that was a question students had about the generalizability. My gut here is that they're probably, given what this is about, like, the fact is, do I get to know you and trust you? I don't know. I don't have theory of why that would differ between men and women in general. Maybe in a specific context, you would have differences. So, for example, in this study here, we generally particularly in Muslim households, if we wanted to interview a woman, we usually had to interview their husband first. So the husband was comfortable with the questions. Um, and so there could be in like a certain, like just more resistance to contact because they have less public lives. So there could be something there. As I said, we didn't get that difference here, but I could imagine under certain situations, because women are less likely to have contact, um, they, it would be harder to say do such a program.
I wanted before I
And
got
then
to
another,
sorry.
okay.
Well, before I got to Nike's second question, Steve asked, as a technical question, what is the coefficient that is the label on the x-axis on this slide we're looking at right now? And don't get to the he had two technical
So,
questions, so the
the
coefficient here.
the coefficient, so which specific coefficient are you asking about? So it goes to 0 to 0.3. So that is, so I'm not, so is there a coefficient you're specifically asking
He's talking
about?
about the one on the x-axis.
So the x-axis goes from 0 to 3.3. So I'm not, so this is the beta for the variable, and it's standardized at 0, from 0 to 1, if that helps.
We'll wait to see if we get a response. Beta
Okay.
coefficient. There we go. That was the answer.
Okay.
Then back to the second question was, has this type of research been done with refugees or migrant populations?
So in different ways, yes. I have other work that wasn't specifically contact, but it was hosts and refugees in Lebanon and Jordan who were in the same classrooms. So somewhat similar to a study that a colleague, Alex Scacco and Shana Warren, did in Nigeria, where they did it with computer training between Muslims and Christians. We had a study in in Jordan and Lebanon. But I will say it's unclear how much contact happened in the classroom, so I don't want to overinterpret that. I will say there's another study about IDPs in Afghanistan and host communities. What I worry about, they find that contact didn't work. I'm slightly concerned about that analysis, partially because of the analysis, because of the work I did in Jordan and Lebanon. So in that work, they find contact didn't work, but it was all Pashto population in that area of Afghanistan. And so there wasn't a really strong divide. And so you often find, particularly if people come from the similar background, people do feel somewhat like sympathetic to people's plight. And so that we saw between Jordanians and Lebanese, especially early in the conflict, the Syrian conflict. And so I'm not surprised that they don't find something, because there wasn't a big divide to begin with. And so you're not going to see, you just have a ceiling effect.
One thing I want to be mindful of as we are closing
Yes.
on the end and everybody's time, and again, thank you everybody for your questions and for participating. Early on in the presentation, Fatih asked if you could talk a little bit about your Guatemala City experiences. And I just thought I want to get that. I
Okay.
didn't want to like try and close down the presentation here, but I thought it was a question that
Yeah.
might be worth the time.
So, I mean, I will say, so that program, it was an interesting opportunity for me on multiple levels. it was a program that I initially didn't think we would design. And then when the request for application came out, I said we needed to design this program. And it was, but it was a program which the theory behind the program was not well founded, I will say. It was a program that said if you do something called community driven development, so you try to build social cohesion, um, or try to have the community do things and make decisions, they will have more cohesion and then violence won't come to the communities. I will say it sounds similar to the program I did in Nigeria, but I will say that is a very rare program that has those effects. And I can talk, I know we're out of time, but I have theories why we find effects, but most of the literature on community driven development says it doesn't build social cohesion. But why I got excited about doing that program, most of my work had been on, try, up to that point, trying to curb, help communities and particularly prevent young men from joining violent extremist movements. And so I was taking my experience working on those programs and bringing it to looking at gang violence. And so that was the first time I was able to do that. Um, and so I will say, yeah, so it was an exciting time to, like, as I said, trying to see what generalized from my work largely in the Middle East and Afghanistan and how to bring that to an area I knew nothing about. Um, like, so where are we on questions? Because I also know we're almost out of time.
We don't have any questions sitting at this point in
Okay.
time. So if there's anything
Okay.
else up, then hold on. We just got one. We just got a question.
Okay.
That's what happens when you come to the end. So
Yes.
Janelle asked, there's so much good research, but the question is, how is such work is reaching program designers or officers in the public sector and other sectors doing peace building work? Congressional continues, congressional staffers, for example, love to know effective programs to have their bosses support.
So I will say, in my prior life, um, I was very involved at the beginning of a bill for that was passed during the first Trump administration, called the Global Fragility Act, and how that bill was initiated is I would go up with policy advisors up to Capitol Hill and brief largely the House Foreign Relations staffers on what was the latest evidence and showed them like we could do something. I mean, we wanted to call the bill violence prevention because we thought we could violence prevention is easier to measure than fragility, and I can talk for a long time about that. Uh, and so that's one thing I used to do quite a bit of. I'm actually going to Frankfurt next week to work with USAID to work with the West Bank Gaza mission on some program design. And part of the reason this colleague asked me to go was to bring the evidence to designing peace building programs with that team, both a peace building and a rule of law program. And there's other academics going to work with the other Middle East missions. And so this colleague of mine at AID has um, I think this has been one of her most successful initiatives is that she's built a lot of relationships with academics to work with various missions on bringing the evidence to their reviews. Like one of the things you can write a synthesis, but it's still hard to know what to do with it. And so building, I think, these type of partnerships are really key in trying to get that evidence into the programs.
So, Professor Wolfe, I want to ask, is there anything else in the deck you wanted to make sure we got to? I know we're at time. Understand if people
Yes.
have to leave. Please, I want to remind folks, you will be sent a copy of this to review at your leisure. But I just didn't know if there's anything, concrete takeaways or anything you wanted to summarize with Professor Wolfe.
I think like just getting back to this is let me or So I think I want to come back to this is it to me, this has been the tool I've used so much in designing programs of thinking through how can I create that situation to help people, whether it's to find peace, whether it is to deal with a humanitarian crisis, recognizing like that's where I had the influence. And maybe over time to go to one of the earlier questions, like how long does it take? What I think could be happening is if you create these positive situations that people are in over time, potentially it does change the person. And then that's when behaviors become more consistent. And so I think like that is the challenge that many programs are such short term. It does not give the opportunity for that long lasting change. And I will end with that.
All right. So thank you so much, Dr. Wolfe, for this presentation. Thank you, Swanee, for also sharing your perspective of being a student of Dr. Wolfe's. And thank everyone who attended for joining us for this masterclass. We look forward to seeing you at another upcoming event. Take care, everybody.
Thank you.
Thank you.